So to that end, Avril, I've heard it said that manufacturing mAbs today requires just as much focus on efficiency and cost efficiency as it does the science and the technology behind that, albeit that science and technology becomes more complex every day. Would you agree? I mean, in your purview there, would you agree, and why or why not?
Yeah, I think part of it is there's not only complexity in our molecules, but there's complexity in our different manufacturing options. So technology has really brought in, we've brought in both single use and larger scale technologies. And so you really have to have some critical thinking, not just on the individual technologies, but on the interdependencies of all those technologies together. And then you layer on regulatory and other guiding aspects of our industry, and it just gets really complex fast. So I would agree that it's important, but it's an important piece amongst other important pieces. And so you have to have a big picture view of it to get it right.
Yeah.
Yeah, if I could jump in there, Matt.
I was going to ask you. I was going to ask you to. Yes.
So, Avril, I really like your comment about the interdependencies. I think that is a critical component of an efficient process, sort of that crosstalk between all of the different functions involved in the process. But really, when I think about science and technology, coming from my drug discovery background, this is where my mind usually takes me. So I think today you're seeing in drug discovery real application of high technology in discovering new drugs. So AI and the computational power, is really being able to take most advantage of all that omics data that has been generated over the last decade or so, and then things like robotics and miniaturization, high throughput analytics, all those sorts of things allow the drug discovery teams to screen thousands and thousands of candidates, exponentially more than we were able to a decade or so ago. But at the same time, I would say there hasn't been an increase in the target space so much, right? So what you have then is a lot of new candidates in a relatively slow growing indication space, which basically adds up to a lot of competition. And so in the end, for a company like AltruBio to be successful, we have to take our great idea and be fast, right? So it's not enough to be better. You also have to be faster. And so I think that's where technology improvements in the manufacturing space can really allow us to get to the clinic, get to the patients, to demonstrate our drug's superiority much faster than we were able to before. And really, it's up to us then to choose the right tools, the right processes to make that happen.
Terrific. So that's a great segue into the next question I had for you, Gene. But before I get to that question, I'm going to ask Miles to present our first polling question. So this is a question for you in the audience. We're going to present this right now, and you're going to have some options, some choices to make here. So taking materials, time, and labor into account, what processes are the least cost efficient in your organization? We're going to allow you to choose two. Media, filtration, cell culture, cell harvest, capture step, polishing step, finish, storage, filling, or analytical methods. Choose two. We'll present the results of that poll here shortly. In the meantime, while you're addressing that question, Avril and Gene, what do you guys anticipate might be the leading response based on your experiences? Gene, since you're on my screen, I'll start with you.
Boy, if I had to guess, I would say the capture and polishing steps. Given that we are in an age now of increased productivity on the cell culture side and also increased complexity on the molecule side, I think those two would put a lot of pressure on those two downstream areas.
Avril, would you agree?
Yeah, I've spent a lot of time looking at this, so it might be a little bit unfair. I would agree that the audience, knowing that capture is oftentimes very expensive, may guess that or choose that. But I know that there's a lot of nuances, and again, those interdependencies. Oftentimes I see capture and media, cell culture media, in a really good competition for the highest cost. And, you know, from the gene therapy experience, I know filtration can add up really fast. So it'll be interesting to see what the audience says.
Yeah.
All right. Well, Miles, do we have some results we can throw up on the screen?
Interesting.
Did you say capture, Gene?
I said capture and polish, so
Yeah,
I think I did okay.
You did. Yeah, you did all right. Definitely. And you also, Gene, you mentioned molecular complexity. So I'm gonna throw out a question from the audience here to both of you. But since you mentioned it, we have a question from Arvind. What are some new challenges you see with bispecifics that did not necessarily present themselves for mAbs? Is that something that either you can address?
Oh, yeah, I can start with that, and Avril, you can jump in as well. I think the maybe most obvious answer in my mind is that for bispecifics, the end product is a heterodimer, right? So you want an antibody with different specificities on both arms of that antibody. And what you often see are product-related impurities, essentially homodimers or single chain impurities. And being able to create a process that can give you the yields necessary to make that process worthwhile, I think that's a challenge. Oftentimes, you have a cell line that's making both chains of a bispecific antibody, and it's really about the assembly and keeping that heterodimer form throughout the process that can be a challenge.
Thanks, Dr. Lee.
Oh, go ahead. I was going to say to Gene's point earlier, the fact that our manufacturing technology hasn't really caught up with the sophistication around molecular design. We're kind of, you know, putting these more complex molecules through older technology, and it's more like, rather than actually measuring and separating based on that, we're using some blunt force instruments to get a mediocre separation.